What other sort of aspects of digital transformation in other industries would you like to see in healthcare? What are some examples of the types of things we should be aspiring to?
I mean, obviously, if I can check in for a flight online, an international flight during COVID, and scan my COVID card and scan my passport and arrive at the airport and they have all that documentation and I'm literally issued a boarding pass, there's no reason why I shouldn't be able to check in for a doctor's visit. I mean, this is literally, we're talking about international travel in a world where we have, lots of different threats, and yet we can make that happen. It should be automated. It should be a link on my telephone. It should be easy. Frankly, anything that is routine that I would call as a patient, I would call the doctor's office to get. There's no reason why I shouldn't be able to do that through a link that is sent to me. If Walgreens can send me a link to refill my prescriptions, there shouldn't be someone on the back end then who then has to pick up the phone and call the doctor to get it done, right? We should automate that whole chain. Even my father, who was 90, had a smartphone. I think when, you look at the adoption rate, even at that end of the curve, there's no reason why we can't be creating an experience that is leveraging the state-of-the-art technologies that we have and using automation to capture that data quickly and efficiently. And so that we make the experience better for both the physicians, the nurses, and for patients.
You said something that was really insightful around using automation to not just improve the patient experience, but also the staff and physician experience. So tell me more about that. Is that equally important? Should health systems be thinking about the staff experience from an automation perspective just as much as the patient experience? And if so, why aren't we spending more time on that?
I mean, look at the burnout rates in healthcare. Every week, another survey comes out to basically describe to us the dire state that clinicians are in. I mean, I think that sadly, the pandemic has pushed everyone to their limits. As I said, healthcare has been enormously tolerant of cumbersome and bad process, but to me, the pandemic has just pushed everybody to the edge. And, we have a profound manpower shortage in healthcare, whether it's clinical or frankly, it's non-clinical, but other highly trained talent. And there's just no reason why these people should be spending their time doing tasks that we can automate. I think about something as simple as what the bane of, I think, everybody's existence when you go to the doctor, are you still on all of these meds? And they ask you through the same list of meds that they go through each time. And it's this concept that we have just made it acceptable that clinicians should just be going through the full list every time instead of creating a process where in registration, the patient does some of that work and that all the physician has to focus on is the exception, right? There's a flag that comes up that says, wait, something new has been introduced here, something new. Let me talk about the fact that you're taking this new supplement instead of having to go through at the beginning of that visit, check, 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 check. Oh, wait, I just had this conversation with you 2 weeks ago. It always seems, the other thing that drives me crazy about the electronic medical record and the lack of automation of this is the fact that, especially in a big AMC, you have each department will have its own version. So even though you update your meds in one department, it doesn't translate and go over to another department's chart. And then back to my insurance card example, anytime we are, trying to scan data, we've got to figure out a way, and we've got to be using the kinds of, machine learning techniques so that data is immediately using natural language processing and, some of the other techniques that exist, that data is immediately being distilled and dumped air-free into the medical record. And we're not asking people on the back end to be re-entering data.